Hey, future medics, Tina here, your medic mentor. Today we're going over a medication you're not going to use every day, but when you do, it's a very serious situation. It's calcium chloride, and there's no brand name to remember with this one, it's just calcium. The calcium's interesting because it's both an electrolyte replacement and a cardioprotective agent. And what it does is it will help stabilize the heart when things are out of balance, especially electrolytes, or there are toxic substances that are trying to throw your patient's heart into a lethal rhythm. So, calcium will increase contractility of the heart and it will also stabilize the cardiac membrane. That is so important in cardiac arrest, electrolyte imbalance, and medication overdoses. We give calcium in a few key situations. The first and the biggest is hyperkalemia. Hyperkalemia. Hypocalcemia, calcium channel blocker overdose, and a cardiac arrest where we suspect any of the three, specifically hyperkalemia. For example, maybe somebody missed a few dialysis appointments and now they're in cardiac arrest. We would assume they are hyperkalemic. Now, the dose is 500 to 1,000 milligrams IV or IO. And this is a slow, very slow IV push over about 2 to 5 minutes. The onset for this one is immediate, and the duration is about 10 to 20 minutes. And this one is also an important one to pay attention with your IV, as calcium can be necrotic to tissues. You want to make sure that you have a very, very patent IV. But because it can still be caustic to the veins, your patient might complain of a burning sensation. Just make sure that your line is flowing well and you're not getting any bubbling. Side effects to watch for are going to be bradycardia, hypotension, and burning at that IV site. So make sure your IV is patent. For contraindications, it's patients who take digoxin. These two do not play well together, so make sure you ask and you look at a med list. Second is going to be hyperkalemia, and the last is VFib. So those are your contraindications. Another important thing to remember is that calcium and sodium bicarb make a precipitant. So you don't want to push them through the same line. They will clog your line and make a hard rock. If you have to use the same line, make sure you flush really well. I'm talking 20 milliliters between each one so you don't have that problem. Here's your takeaway. Calcium isn't a medication you're going to use every day, but when you do, your patient's heart is in danger and you need to stabilize it quickly. Make sure your IV is good. Make sure you know what you're doing and the dose, and you are respecting the interactions and you know what they are. But that's it. That's your last one. That is our last drug card. You did such a good job. You made it all the way through. And now we got to keep moving forward. Next thing we're diving into is paramedic school concepts. So I'll meet you over there and we'll go do something big. Okay? I'll see you soon.